Welcome everyone. Back for another great webinar. Today is on plantar fasciitis. We're going to let everyone funnel into the room here, and we'll get started in a moment or two. Angus, can you move that monitor that way a little bit? Beautiful. Okay, here we are again. Great topic for you today. We're gonna dive right into our plantar fasciitis and Spidertech topic. This gives us an opportunity to talk about many things: foot, ankle, lower leg. Hopefully we get out of it how I feel or how I think about applying and using tape as a add-on to all the other therapies I'm doing. And with any luck, you'll have plenty information to take back to your patients today, tomorrow, and the next time you deal with plantar fasciitis. So without further ado, let's dive right in. If we begin with our mission here, essentially we're aiming to provide you, our medical professionals, which is really the bedrock of our company and the people we serve, with the best and highest quality tape to make sure you can pass those experiences on to your patients and clients. That's what we're trying to do. We're trying to arm you with information, education, so you can better serve your patients, and we're hoping to make you look good with the quality of our products. Me personally, if you've been part of the webinars in the past, you would know golf and tennis is where I spent my athletic career, as well as in a multidisciplinary setting. So all the modalities that we'll talk about today, I have firsthand knowledge with. And I would say from a plantar fasciitis standpoint, if I think about working with, especially in tennis, but golf as well, with the amount of walking and training, if we get to that point where the plantar fasciitis is present, then we've missed something. So a lot of what I do and what I've done has been focusing on preventing these type of inflammatory reactions, preventing these injuries from happening. But certainly if people are coming to us in the clinic after they've occurred, we don't have that opportunity, and we're forced to try to get them back as quick as possible. So we'll hit this today from a preventative, but also a reactionary, trying to get them back on their feet as fast as possible standpoint today. Our webinar goals are quite simple. We're going to arm you with the information as to how Spidertech is used to help it, and it would be plantar fasciitis. And then as well as we're going to look at some videos and go over how we can use Spidertech to treat and make our treatments more effective, our preventative work more effective for all your patients. The secret, the thing that makes our product so great is the high quality materials we use here in Toronto, Ontario, Canada. Everything's made from start to finish here, but also the fact that it is all pre-cut and pre-made for your individual body parts. And so for every part of the body, Spidertech offers a pre-cut option that makes applying easier, faster. It allows the application to stay on for a longer period of time because it's machine cut. You can apply it anywhere you want in the clinic, on the field, because it is easy to throw in the bag, and it is kind of the same thing every time. So for all these reasons, we can allow you to be the better version of yourself, provide a better, higher quality product. All right, so our categories today for plantar fasciitis, pain control is kind of the overlying theme, so that kind of comes in with everything we do. the muscle tone and the range of motion, I think that really is the heart of what Spidertech does, kinesiology tape does uniquely for your patients. I think that's the thing that where if we kind of bring our mind to that, then that's where you can really be effective with using Spidertech. We also can provide some ankle support. Essentially, we're improving the posture, the position, of the ankle. And this is, if you think of this as like if someone sprains their ankle and they have some weakness or they don't have control of their ankle, that kind of takes us into our proprioception and our balance. Same thing if we have an ankle that doesn't have the control, whether it's due to injury or other reasons, that's where that support can come in. And then lymphatics at the end, we'll kind of touch on that, and that's hoping to get rid of any fluid, any swelling, inflammation, for any reason that we get any pooling of fluid in through the foot, the calf, the ankle. That's where we can have a benefit with tape as well. But the sweet spot, the thing that Spidertech offers that really differentiates it from other modalities is that muscle tone. And then in turn, what that does for a range of motion in terms of increasing it and allowing the tissue tension to normalize. So if we dive right in, we're going to go over some brand new studies, as we always do here at Spidertech. Everything is cutting edge, and we're always searching for providing you with the highest quality information. Our first one, a 2025 study, and then with this one, we're looking at the effects of using shockwave versus eccentric exercise and kinesiology tape for plantar fasciitis, and it is a randomized control study for pain alleviation, functional mobility, and psychological resilience. And I like these because they do provide a number of different interventions. The reality is that most of these interventions in the clinic, we're never going to apply just one at a time. We're going to combine them. We have all these things at our fingertips as therapists, and so we would generally combine all these ideas into providing the best experience for our patient. But as we kind of dig in here, we'll kind of revisit that. In this study, they went shockwave versus the eccentrics and tape, and although it was a 8-week study, the interesting thing is that they provided eccentrics was once a week, the shockwave was once a week for 4 weeks, and the tape they applied it up to 7. They would let it be there for 3 days, but they would retape every week. So there's a time period in there where we didn't have tape on the bottom of the foot. So we looked at shockwave at the insertion of the plantar fascia at the calcaneus. We looked at tape, which was applied at the bottom of the foot, and we looked at eccentrics, which was addressed or was aimed at the calf and lower leg. And so what have they found? After 4 weeks, we saw that with our eccentrics and kinesiology tape that we had a 35% decrease in our pain. After 8 weeks, we saw that we're up to a 48% decrease in our pain. And then our functional mobility, which again, this is kind of where our sweet spot is with tape, is that after 4 weeks, we saw a 43% increase in our range of motion, and after 8 weeks, a 50% increase in our range of motion. Where with our shockwave therapy, we saw moderately better results with our pain, but with our range of motion and our function, we saw better with kinesiology tape. So if we kind of dive into our graph here next, we see that kind of pain and then also the function, and we see best function was found with tape, and kind of a similar pain level was found both with our shockwave and our tape, and eccentrics all got great results there. So what they concluded with this study was that both were very effective. Both the shockwave and eccentric exercise demonstrated to be very, very good in terms of for plantar fasciitis. The shock wave produced a more rapid and pronounced reduction in pain, whereas the eccentric kinesiology tape yielded superior and sustained improvement in functional mobility over the 8-week period. Neither had a significantly psychological improvement, and how they determined, or what they thought that how we could apply this to the clinic would be that these findings suggest that the treatment selection should be tailored to a patient-specific needs. The shock wave favored an acute relief, where the eccentrics and kinesiology tape prioritize long-term functional recovery. Integrating both approaches may offer a more comprehensive strategy for optimizing outcomes in plantar fasciitis rehabilitation. So that's going to be a theme we see, is that there's many things we can do to get an initial reaction of pain relief. There's where I think kinesiology tape is going to fit in, is that we're decreasing our muscle tension, we're normalizing our the tonicity of the tissue that we apply the tape to, which has a significant approach and significant effect, and I want you to be thinking of that with your patients. The way that happens is something we've addressed many times. Quite simply, the tape goes on the skin. It elevates the skin because of the elastic property in it. So we get a skin elevation, which provides a constant rubbing, provides a constant stimulant to the nerve receptors that are within the skin, and primarily that is going to be our Merkel cells. For the simple reason is that just provides consistent information to the skin, to the brain. So that constant neurological input coming from the tape, you could thinking of it as like something that's constantly rubbing on the skin like this, is enough to allow the brain to decide to normalize the tension through the tissue. So it is that mechanism that we're going to see over and over again, whatever tissue it is, whether it's the bottom of the foot, whether it's the calf, whether it's the hamstring. We see a consistent ability for the tape to normalize tissue tension. And if the tissue tension was the reason for the range of motion deficit, then that's where we're going to see that restoring of our range of motion. This is something that I've done in majority of the seminars in person that we teach. I did it last weekend in our seminar, and I suggest you maybe even do it with your patients, and certainly with yourself. So get some tape on the bottom of the foot, get some tape going from the plantar fascia up over the Achilles tendon into the calf. Do a knee to wall test before you put the tape on to determine your dorsiflexion range of motion, and then put the tape on and retest it. And there's a high level of confidence that you're going to end up with increased dorsiflexion. And the reason for that would be that if tissue tonicity was the reason for the dorsiflexion limitation, then instantly we should see an improvement. It was something that, because of the research studies that I read, where I was confident that I could do that in person, it was a leap of faith. But since then, in almost every case, there's a 1, 2, 3, and even greater centimeter increase in dorsiflexion instantly with using tape. All right. So if we dive into another 2025 study, this one, we threw out the eccentrics. We looked at just purely shock wave versus our kinesiology tape, and we certainly combined those. And wanted to see the results on flexibility in the ankle, and then we proceed here, and we can see what the tape application they did. And so this is exactly what I was talking about. Try this when you try this on your own. Go from the kind of the base of the toes up over the plantar fascia through the Achilles tendon and up to the calf, and that's where we'll see those improvements in our dorsiflexion. They also provide a little bit of arch support in this case, which I'll do commonly. So I would highly recommend this application for someone who has tissue tension up the posterior chain, as well as someone who had maybe a weak arch, or had ankle instability. And so what we saw here is we went our shockwave group, we see our shockwave plus tape group, and we see our shockwave placebo. And the significant finding we see here is that in both the shockwave and the tape, we see that your VAS went from a 6 to a 4, which is a 25% improvement. The placebo group went from an 8 to a 7, so they saw improvement as well. But we saw a 25% improvement in pain with these two groups. But the significant part was that we went from, the only group that saw an increase in mobility was the group that had the kinesiology tape involved in it. So the piece we just spoke about, we're seeing that improvement in flexibility purely because we've normalized tissue tension. That came with our kinesiology tape group. And again, that's something you'll see reproduce in many parts of the body. And I think that's, again, how we want to be thinking about using tape. So with our conclusion here, if we kind of get to the heart of it, that because the placebo group went from an 8 to a 7 on the VAS scale, that wasn't enough of a change in our pain, although we did see a 25% decrease in pain in our tape group. But again, the findings strongly support the integration of our shockwave with kinesiology tape in early plantar fasciitis rehabilitation protocols to acutely increase plantar fasciitis flexibility. The placebo's selective effect on subjective pain perception further validates the specific biomechanical effects of the shockwave and kinesiology tape combination in tissue properties. I think whenever you're in clinic, whenever you're getting your hands on a calf, whenever you're getting your hands on a plantar fascia that you feel has extra tonicity to it, whether they come to you with plantar fasciitis or not, I highly recommend getting tape on that area, and they'll come in a week and you'll see it better. You can wow them by doing the knee to wall test. You can test their dorsiflexion and show them what the tape is going to do. And I would even go further than that. What I would do is I would test their dorsiflexion. Again, this is with or without plantar fasciitis, just someone who felt had extra tonicity through the calf or plantar fascia. Test their dorsiflexion. Do your intervention, whether it's soft tissue, whether it's mobilizations, whether it's manipulating the ankle joint or any other joint within the foot, whatever your soft tissue you're doing for the calf, whatever eccentric or other exercises you're doing, whatever stretching you're doing, if you're doing foam rolling, whatever you're doing to help normalize all these things. Do your measurement, do your intervention, finish your intervention with using Spidertech up the bottom of the foot, up the calf, dorsiflexion test again, and I promise you, you will look very good. You will look as if you've made significant improvements in dorsiflexion, and specifically if that was a limitation, but that's something that spans, I think, a huge percentage of our patients. Again, whether it's easy when they come in with our plantar fasciitis or issues in dorsiflexion, but somebody who wants to squat better, someone who's struggling with a plank or push-ups because their dorsiflexion is poor, someone who is struggling with a lunge because their dorsiflexion is poor, and then a ton of stress is going onto their toes and their ankles kind of falling inwards because they're trying to find motion within their foot because their ankle's stiff. Whatever the reason is for whatever they're trying to do that they're struggling with, functionally or pain-wise, this is very applicable and something I would do in clinic many times a day with patients for all different reasons. All right, and to finish this thought on our flexibility, we look at another brand new study. I believe this one's from 2024. A combined neuromuscular electrical stimulation with elastic kinesiology taping, improving ankle range of motion, equivalent to static stretching in untrained subjects. And so again, this is just a way of thinking about what the tape can do. everyone accepts that stretching is a way to increase range of motion, and then we see in this study that using the tape and electrical stimulation will be just as effective. So with our dorsiflexion and our SLR, so up and with our hip, we saw that there was statistically significant improvements with getting tape up the posterior chain through the calf with those individuals, and it was equivalent to stretching on its own. So, I mean, they used it as they phrased it, if you don't have enough time to stretch, well, here's another intervention for dorsiflexion or SLR, a straight leg raise. But we can do both. Of course, we're going to have some people stretch if they have limitations, and we can further benefit from using tape as well. So, just another piece in our toolbox. Again, whether you're doing soft tissue, whether you're doing stretching, the tape would be the final piece to add on after that. So they conclude this is the first study to demonstrate the combined intervention of our neuromuscular electrical stimulation in elastic tape, so Spidertech, is an effective and safe method to improving flexibility over a short period. This suggests its potential as an efficient alternative to stretching. It doesn't have to be an alternative, it can be in addition to, in competitive sports and health promotion programs. The combined intervention, which improves flexibility within a short period, could be particularly advantageous in scenarios where the brief warm-up before matches or time-constrained rehabilitation settings. Future studies are needed to validate this practically of the intervention by expanding the target population, athletes, patients, so on. This research could also provide deeper insight into its broader application and sustaining across different health conditions. And so that idea, and I like this one because it looked at both the ankle dorsiflexion, also the hip range of motion. There is studies that look at those things individually, so looking at purely dorsiflexion, looking at purely the straight leg raise, so the hamstring flexibility. And all of them instantly will show that, all of them show that instantly with using tape that there is a range of motion improvement, and they also show that with over time, over hours, that the range of motion improvement increases. Going back to our previous explanation where we're stimulating the nervous system to allow the tissue to relax. That's purely what we're doing. You can think of something like what you'd expect to see if the nervous system was protecting an area of the body, it's gonna provide tension to the muscle to constrain, to provide some support. It also is going to make it so you can't contract the muscle very effectively. And this is shown in research studies as well. This the glute medius comes to mind, where they saw that by applying tape to an area where the glute medius was we'll call tight, that instantly we saw that the tension went away, but also the ability to contract the muscle went up. So muscle tension went down, muscle 1 rep max or muscle maximum force went up. And that's what we can expect to see in all parts of the body. Great. So if we dive into our application here, here's one that we'll use for the arch. I also chose this because it brought up another idea where, although the subject in this case doesn't have a bunch of hair on their leg, but if someone does, I have found that kind of wrapping it around like that spiral way allows the tape to adhere. So many times in that case, I'll tell the person to trim the hair in their legs, but if that isn't a possibility, I will kind of go more of a spiral way to help with the adherence of the tape to the skin. But what we see here is if you had a patient who you thought that their plantar fasciitis was a result of a poor arch, so you saw that the arch was overpronating, in this case, that would cause the plantar fascia to splay out and to be overstretched with every step. This would be one method that I would use to affect the arch, to essentially provide some stimulation to the brain and a little bit of mechanical support as well, to allow the foot to be a little more stable and to deal with every step a little more effectively, so we don't get that tug on the bottom of the foot. This would kind of be maybe like the subacute phase in how I would tape, in that when I was we got rid of the initial phase of just trying for pain control, and this is how are we going to tape to kind of take care of the problem. If the reason for their plantar fasciitis was that their arch was collapsing. All right, good. So we move on to our next study here. And this, again, Brandon, this is a 2023 study. This kind of takes us into our mode of how we can provide biomechanical support. It leaves a little bit of our muscle tension piece behind, but it really doesn't, because this is providing, in this study, they provided support to the fibularis muscle group. They provided support to the tibialis posterior, and they looked at what the result was on the foot, essentially. And so, again, this is one that we're thinking, okay, like we're providing, even though this maybe wasn't providing like a constraint support, this is providing support to the muscles that we want to work to allow there to be less medial lateral collapse in the ankle. So comparison between the effects of tibialis posterior versus fibularis longus kinesiotaping on foot posture, physical performance, and dynamic balance in young women with flexible flat feet. So arch was collapsing. What can we do to support this? So here's how they taped. The tape application went either up the side of the foot or, well, either up both feet. Obviously, at the top one, we get the tibialis posterior. The bottom one, we get our fibularis group. And the nice thing is that we see that both are very effective. We also see how simple it is to provide an application like this. I mean, get your hands on the fibularis, get your hands on the tibialis posterior. What I would recommend is if either one of them feel like the tonicity is poor or increased, if you feel like that needs some support, then just tape like this, and it's like you're going to be in business. As you go into the bottom of the foot, I'll be careful never to kind of like stretch the tape as we go around, in that I don't want to be tugging the skin on the bottom of the foot in any direction, and I don't want there to be kind of tension through the tape. So as you're going around the bottom of the foot, I'll always be sure just to provide no stretch in the tape, and I'll do the same thing as we kind of go up and through both sides here. But how simple this is. And what we saw is that both in our foot posture index, so our ability to maintain our arch, we see a 25% increase after 30 minutes of wear of our tape for that, and then we also see a 21% decrease in our navicular drop test. And so again, the navicular stays in the ideal posture. Essentially, in both cases, the arch is maintained, the arch is higher, the arch is improved for someone with flat feet, and really within only 30 minutes of wear. So you would decide from here if how much support you want to provide, and support would be in the terms of stretching through the tape. I'm constantly surprised how even with no stretch in the tape, there's improved performance, and so I'll leave that clinically to you, but I think whether you put any stretch in the tape or not for support, or just provide neurological support, proprioceptive support, that I think you're going to do very well with both cases. And they conclude that kinesiotaping of the tibialis posterior can improve the foot posture and physical performance of young women with flexible, flat feet. Additionally, kinesiotaping of fibularis longus head leads to promising results in the foot posture and dynamic balance in this population. No significant difference were shown between the two groups. In addition to the tibialis posterior, it is suggested that the fibularis longus muscle be considered a therapeutic target for management of flexible flat feet in healthy young women. So, I mean, it's a great conclusion right there. Anyone who has flat feet, we saw that initially that's going to lead to any tissue tension. And if we see tissue tension, we're going to go up the posterior chain. And additionally, if we provide some medial lateral support to the foot and ankle, that we can help the two medial lateral supporters of the foot and ankle. So combining those two things, I think, is going to be a fantastic idea. Yeah, that's perfect. Yeah, that's perfect. So if we dive into an application video here, this is the first part that we mentioned with just kind of getting through that posterior chain. If this would be the staple for anyone with plantar fasciitis that comes in the clinic, anyone with a dorsiflexion limitation, anyone with calf tightness, Achilles tendonitis, any kind of bottom of the foot issues, this is the first piece of the application that we're going to apply. I'm going to start at the kind of just below the toes. We're going to do the application of the tape in a position where the ankle is dorsiflexed, the toes are extended, and then I'm going to go over the bottom of the foot with no stretch. Once I get to the heel and I go over the Achilles tendon, you can see how I kind of this is an area, depending how thick the Achilles tendon is, that it can be tough to get the tape to adhere smoothly to around the heel and over the Achilles. And so this is where I'll kind of maybe even provide some stretch or wiggle my way around right here to make sure I get onto the flush onto the skin. And then from there, I will proceed up into the calf without tensioning the tape, zero tension, and again the ankles in dorsiflexion, the knees in extension, so that I'm not limiting any range of motion. My concern would be here is if we did with a bent knee or a plantar flexed ankle, is that I'm going to limit dorsiflexion and depending on how high up I go into the leg. Knee flexion or ankle, certainly ankle range of motion. So I'm going to do this in a stretch position with no stretch for the most part, and that's where I'm expecting to see a decrease in muscle tension through the calf and foot. If we skip over to the next application video that we had up there. There was, yeah, this one's great. Yep. Can we possibly go to the next one, Angus? It's a great time for that. There we go. Yep. Here we are here. So this is a situation where we are combining all the topics we just spoke about into one. So we have arch support, we have medial lateral ankle support. And the thing to consider here for me is what's the most important thing, arch support or ankle support. Most times, if it is ankle support medial laterally, I'm going to put that strip on, which would be the blue strip. I'm going to put that one on first. I'll go in the reversed order here. And that being is that if that's the case, I want the most important piece to be on flush to the skin the entire way around. The tape adheres better to skin than it does to other tape, and so that would be the focus. But either way, we see that in this case we have arch support, which would decrease the chances that we get a falling arch, increase the chances that we stop irritating the plantar fascia. And then we also get that medial lateral support that would affect the fibularis group, the tib post muscle, and also provide some stability to the ankle in a case where there is an ankle sprain or things like that, or laxity in the ankle. The only other piece here that we just saw would be if we added the posterior chain tension. Those would be the three applications that I'm thinking as we think about all the possibilities for taping for plantar fasciitis. So we have posterior chain, and then we have these two applications here for the arch and for the medial lateral support. Excellent. Okay, so that wraps those up. We're going to take a little look into this next study. It's a 2018 study, and it just kind of gives the idea for our balance and functional support for our plantar fasciitis. The effectiveness of kinesiotaping on balance and functional performance in subjects with plantar fasciitis. The key thing being here is the expectation that the tape is going to provide muscle tension support. It is going to provide structural support, but the constant feedback on the skin, the same way that we mentioned that it is going to normalize tissue tension, it is also going to provide constant information for the brain in terms of proprioception and balance. And so this isn't something that, if your balance is already perfect, if your balance is fantastic, this is not going to make you super balanced. This is not going to be make the great even greater. What this will do is, if there's an issue with your proprioceptive awareness, if due to injury or due to laxity or due to detraining, you have poor proprioception, and I'll add in if there's muscle fatigue. In my case, a lot of times it would be from be like a DOMS muscle fatigue from just being stressed and overworked and after a hard workout or competition. And for any of those reasons that your balance or proprioception has been decreased from your baseline, that's where the tape on the bottom of the foot is going to restore or get you back to what your normal baseline would be. This is seen in the ankle, it is seen in the knee, it is seen in the hip, it is seen in the shoulder. Every place they measure this, where and a lot of times they'll use a DOM, so they'll do excuse me, an eccentric workout. An eccentric workout where they expect to induce muscle fatigue. When they get tape on the area afterwards, you get back to your baseline significantly faster. So we're stimulating the area to allow your brain to realize where you are in the space. Your brain gets more information, and so you make these corrections on your own. But it also takes us into the next idea, which is not only are we increasing the awareness to this area, we're also allowing any fluid in the area to move out as it normally would. Whether it's inflammation due to plantar fasciitis, whether it's fluid inflammation due to muscle breakdown from a delayed onset muscle soreness, whether it's inflammation due to a bruise or any other reason why you have blood inflammation, swelling in the area. If you have a chronic condition and we have pooling in the leg, whatever the reason why there's extra fluid in the area, the tape lifts the skin, it pries open those lymphatic vessels which lie generally right underneath the skin in the subcutaneous space. So you can think of it like the skin, because of the lift from the elasticity in the tape, it's going to lift up our skin. The lift is going to allow the congestion, which the fluid is creating. It's going to allow more space for those lymphatic vessels which were being squashed to actually open up and allow the fluid to move out as it naturally would. Again, We're never getting past what our normal baseline is, but we are getting to our normal baseline when, for whatever reason, the fluid is creating a situation where we don't have that. So if there is going to be pooling, if there's going to be fluid, opening up the area with the tape and the elasticity of the tape gets us back to our normal baseline faster. And from an athletic or performance standpoint or pain standpoint, we would expect decreased pain because we don't have the neurological input from swelling being in the area and in our body sensitizing the area. So we get back to being pain-free. We get the fluid out of the area so we don't have the tissue congestion, which means our range of motion is better, our strength is restored. All these things that you would expect from just allowing the flow of out of the area. And from an athletic standpoint, what it means is that you get on the field, the court, the track, whatever it is the next day, and you feel like yourself again. You don't feel puffy, you don't feel congested, you don't feel all swollen, you feel like yourself, and which makes a significant improvement. And I mean, when everyone could think back to a time where they were sore due to a workout or due to athletic activity, it takes a couple days. And so getting tape on the area, allowing the fluid to move out is going to get you back to feeling yourself in a much faster way. In the study, we can see that the tape application was quite simple. They got tape for the plantar fascia and the Achilles tendon. They also got tape over top of the medial and lateral arch. And the study concludes that the application of kinesiotaping was found to be effective in improving balance and functional performance in subjects with plantar fasciitis. I mean, that's very simple, very straightforward. You do better with tape when you have plantar fasciitis. Okay, so to wrap it up, we're going to do one more video here, and the reason we want to do this one here is we get a sense of how we would tape for a fluid congestion anytime there is a fluid issue, and this is using our Spidertech fan. So not only do we get the benefit of the lift on the skin from the elasticity of the tape, we also get a benefit from the fan's alternating tape, no tape, tape, no tape design or application on the skin. And so what happens here is we're drawing the fluid away from the area where no tape is because the tension, the tissue tension is higher due to congestion. So due to our osmolarity rules or osmolarity principles, we're going to draw fluid away from the area of high tension to the area of low tension, which is under the tape, due to the fact that we've lifted the skin up. And so we get the benefit of the skin lift, and also we get the benefit of drawing the fluid into the area where the skin is. So anytime I see someone who has a bruise, swelling, congestion of any type, we're going to use the fan as the gold standard application for these people. The same way with anyone who has lymphatic issues, we'll always use a fan to help normalize or get back to or decrease the results of lymphatic congestion. We also could easily use this on the bottom of the foot to improve with our plantar fasciitis. So to wrap up our webinar, plantar fasciitis, for all the reasons we mentioned, we get pain control. The pain as a result, it can be from our tissue tension, it can be from lack of support, it can be from poor proprioception and balance, it can be from lymphatics that is causing congestion. Pain is something that happens as a result of all the next pieces, but for our muscle tension, for our range of motion, we see how significant the tape can be in this arena. We saw that providing support, whether it's a structural support, pulling on the tape and creating a stretch and a constraint, or a neurological support from merely putting tape on the area and highlighting the area for your brain to provide more awareness and be in more control, which is kind of which is exactly what the mechanism we see for increased proprioception and balance. We're just providing more awareness for your brain of the area, and your brain gets to provide the support. And then lastly, our lymphatics. We see that by opening up the area, like prying the skin up off the underlying tissue and fascia. We see that we can restore the integrity of the lymphatic vessels that were being squashed from fluid below, and we can allow the fluid to move out of the area that the same way it normally would before the pooling occurred. For all these reasons, we see that the tape is a fantastic finishing move. It is a fantastic last thing to do in addition to all the other therapies, modalities that we saw with that you will do, and also the ones we saw within all these research projects today. So to wrap it up, our tape, we see it has multiple ways of helping. It certainly is a great way for you to stand out with all the other therapists in your area, in that our tape appears high quality. It is high quality. All of our processes and our applications are made here start to finish in Toronto, Ontario, Canada. And then it is also the piece that spans between your treatments. And so you're doing so much in the clinic, the tape is on there between treatments, and so they come back to you being in a better place the next time you see them. And it also is a unique in that people see your clients wearing the tape, and it's a conversation starter as to why you're wearing it, and that turns into a conversation about you, and turns into a conversation about the great therapy you provide. So for many reasons, we see the benefits of using Spidertech for plantar fasciitis. All right, that wraps things up. Let's dive into our Q&A. Ask any questions that you have, and then we'll put a cap on our webinar this month. Right. Thank you, Anita. The question is, in our chat, is how would you tape for a Baker cyst? Where would you place the tape, or use a fan for the movement of lymph fluid and not increase the cyst? So a great question. It is very much a question of it depends, but I'll give you kind of what my thought is for a Baker cyst. I'm going to get tape over the back of the knee. I usually will not use a fan for Baker cyst, just because usually with the Baker cyst, there's just so much, for a couple reasons. There's a wide area where that always seems like it's congested back there. So I kind of like to get tape over just the whole posterior knee. And so I'll use a hip splitter many times, but using a roll over the back of the knee. I'll generally do it with the knee extended. I'll do the hamstring back posterior knee and then down through the calf. And I'll do it with no stretch, in that I don't want to be limiting knee extension. I don't want to be, unless there's hyperextension, but I generally don't want to make it known that there's tape on there for the like, I don't want to promote any posture. The only time I would use a fan over that in that case would be if although it's because it's kind of a sensitive area, if the tape was if the person was sensitive to using the back of the knee. In that case, I'd use a fan because there isn't as much coverage. So that would be kind of my thought process there. And then also with the Baker cyst, like there's going to be general swelling because there's probably some arthritis and also things happening. But whatever the reason for the Baker cyst is, there's probably going to be swelling on the area, and so I will get kind of full coverage. And so I'll get over the posterior knee, and then also many times I'll use a knee pro cut over the front of the knee as well, to try to correct whatever the reason for the knee mechanics being off and the Baker cyst being present. So we'll kind of diagnose what's going on with the knee, whether it's arthritis, whether it's a meniscal issue, whether it's a patellofemoral issue, whether it's some quad tight tension, whatever the reason is that the knee mechanics are off, and then Baker cyst begins. I'll try to correct that maybe in the anterior portion of the knee, and then I will also get tape, as I mentioned, through the posterior knee to help with any kind of congestion and sensitivity through there. So generally that's going to be a combined approach for the Baker cyst. And so yes, if any more questions in the chat, feel free to add them in. I'll also, you're welcome, Anita. I'll also mention that that the three things I'm thinking, again, when we're looking at plantar fasciitis for patients is there tension in the plantar fascia? Always. Is there tension in the back of the calf? Almost always. Is there tension in the Achilles tendon? Almost always. I'm going to get tape up the posterior chain. Is there a arch of the foot weakness? Most times. Then we're thinking getting tape over the arch. Is there a medial lateral ankle instability, weakness? Many times. Is there a tibialis posterior weakness? That goes back to our arch. Is there a fibularis weakness or tonicity? Most times. That's again we're getting it up the medial lateral side of the lower leg. So those are the three things I'm generally thinking with the plantar fasciitis. The other one would be if the tibialis anterior was constantly being activated, it was causing compression in the ankle, which would decrease the dorsiflexion. If that was putting pressure on the reason for the plantar fasciitis. So in that case, the tibialis anterior or anterior ankle tendons, muscles, were providing compression in the ankle joint. If that was overstressing the plantar fascia and causing plantar fasciitis, I would then get tape over top of the anterior ankle in an attempt to normalize the tension in through the anterior part of the ankle and up and through the lower leg, allowing the person to express their dorsiflexion, allowing the plantar fascia to not be stressed and not rely so much on toe extension. So that would be the only other thing I can think of where we're getting kind of tape in other spots other than the arch, medial lateral ankle, and posterior chain. Okay, so let's wrap that up there. Another great webinar. We're going to dive into more topics. If you have topic ideas, throw them in our school's platform. It is the place where we house all of our information on education. This webinar will be put up there. It'll go with the 21 other webinars that we've done over the last couple of years. That's all housed there for you to go back and look. It is also where all our other high quality education pieces are situated. You get them for free. Other companies charge hundreds and hundreds of dollars for the education that you are getting for free with Spidertech. It's on our school's platform. You just have to sign up as a medical professional with Spidertech, which gets your discount to product. But get on the school platform. It's interactive. You can chat with other people. You can post things. In addition, that it's where our bank of education is that you can look at your own leisure. You can go back and look at it many times, and you can kind of funnel through all the different topics that you want. I highly recommend it. Our goal here at Spidertech is to arm you with the information you need to be effectively providing and applying Spidertech, and we're providing you that at no cost. So it's a huge benefit to you as a clinician to get on there and to just soak that part in. Yes, thank you, Angus. Just was posted. Get on there, immerse yourself. Send this video to anyone else, or revisit it when you come across someone with plantar fasciitis. Look forward to getting into next month's webinar. But as I was saying, throw a topic idea in the school's platform. We're we've reached in there for our topics in the past, and I hope to do that in the future. But let's wrap this up now. Hope everyone has a great month, and we'll see you in December.